But before we get to MRI, we want to talk about the bigger issue of your knee, which is your arthritis. And with your arthritis, there are basically two pathways you can go ahead and take care of this arthritis. The first pathway is surgical. And one of the most common ways to take care of arthritis right now is to replace your knee. And the good thing about replacement of your knee is that it tends to be reliable, durable, and reproducible. And what I mean by that is that close to 90% of patients get close to 90% pain relief with a knee replacement. And if you even look out 30 years, almost 80% of those patients still have that same knee replacement working well. So it has some durable results to it. However, because it is a surgery, there's potential complications like infections and blood clots can come loose, nerve damage, artery damage, tendon damage can happen. And also there's about 30% of patients after a knee replacement will have issues with their knee replacement, such as when they kneel, it bothers them. When they go down the stairs, it just doesn't quite feel as stable as it was. And other issues like with sudden side-to-side movements, it may give a little catching here or there. But overall, patients tend to be pretty happy with it. The other issue is that because it's a surgery, there's some inconvenience that's associated with this. So you're usually in the hospital about a day. Most people are able to leave the next day. You're normally walking up and down the hallways. But you do have to have somebody take care of you around the clock, 24/7 for about 2 to 3 weeks. And then you have therapy for about 6 or 8 weeks. And we do a lot of things to help control your pain afterwards, multiple pain treatments such as injecting around your knee, using different types of pain medications that don't make you real drowsy but help take care of your pain afterwards. On the other hand, you can treat your arthritis without surgery, and that's the different pathway. And in that pathway, we look at your knee as a math problem. And the math problem is pretty simple. It says that every day you make cartilage cells and every day you lose cartilage cells. And what has happened over time is that you have just lost more than what you made. And the net result is now that you have some pain and inflammation to your knee. But that pain and inflammation to your knee is just not the loss of cartilage, but it's also a biochemical change that's in your knee, where there are certain chemicals in your knee that start to rise, and their concentration can cause further pain and destruction to your knee, even though it's trying to repair itself.